Talking Point platform. TTPTB. Oh yeah. Unale we pledge with love and loyalty to we sweet, sweet mama salute. Now we all come together as one. For tomorrow, now we go make salute.
Infectious agents, and so we're not put down to the general public. So they will get incinerator them, we get ways for handle them so that you be able for completely destroy any virus or any bacteria with it before you go into landfill. So we manage that aspect of them. But all of the general public sanitation is in the new ministry.
So in terms of this transition of changing the health, removing it from the Ministry of Health, when I be the state of the sanitation, especially now hospital area them, because not to follow transition day or handing over, but let the other institution really get a responsibility, not later say, well, we meet a huge tax, so it gets for take time. Follow able to give a result which will be reflective.
So the sanitation, not to hospital no more before. In fact, the highest number of health worker them now being sanitary inspector. In fact, the Ministry of Health is start from that side, from sanitary worker. And so nearly every district, every chiefdom, we can get sanitary worker. They really ensure then they go around and make sure say the yard then clean. They make sure say mosquito they know they grow. They make sure say people then they adhere to their waste management. I think it's a general thing for the public. But the hospital, their own waste within they generate is slightly different from everybody else. So the state of health from the ministry side, we've been focused a lot more on the hospital waste than we've been focused on the general public waste. So I think it makes sense for let them move the sanitation come off from the Ministry of Health for go to the Ministry of Water and Sanitation. Again, I think for me, I'm gonna joke with people that will be call an MOHS. I say the S now small s, but you actually need for big capital S. And I'm glad we in a new ministry now where they take as a capital S, we go allow you for focus on the sanitation issues within the hospital.
Is it that the sanitation aspect of the intern and the way we deal with the Ministry of Health and Sanitation are be a burden to the ministry?
No, not to burden. I mean, we have responsibility. But you know what you do tackle multiple things at the same time. I think there would be need for give a little bit more attention to environmental health, to the sanitation aspect. Again, where you get situation where 30-day people then they get open defecation. Now they're completely unacceptable. They get major health implication. People then they get open urination, completely unacceptable. And I think one of the things that we'll be trying to do now for completely ban open defecation, for work with people and for create their own latrine and for manage their own latrine and for make sure say every community get latrine, for make sure say every house where you build get latrine component for them. So again, I think that's an important aspect of the work. But we've been just so focused on the hospital and now we not give enough attention to that. So I'm glad with new ministry they take full responsibility for that. Now they support them as well.
The sanitation aspects don't go to water resources. When I don't left with the health, what's in the happen at this sector?
Well, really exciting at the health sector. So again, just not only the area, but the Hajj and pilgrims and come forward. We fortunately would establish a new National Public Health Agency. The National Public Health Agency then get major responsibility. First responsibility for prevent outbreaks of any sign. At the same time, then they prepare for outbreaks. The third, then they respond to outbreaks. So where you see like them pilgrimage, so we go, the NPHA being actively involved, first for ensure say every pilgrim we go, then get the right vaccination for COVID. Then when the negative will come back, NPHA makes sure say we work with Minister of Social Welfare, we work with the Hajj planners for make let people that understand waiting and get for meet within Kaya. So we then come. Fortunately, we get the old terminal at the airport. We set up 20 solid workstations there for meet the Hajj people, and so that nobody know they spend more than 5 minutes at one location. At the same time, when they're ready for go, we give everybody care package. We include hand sanitizers, we include masks, we include infographics for help them. At the same time, we don't alert all of the district medical team and the health district health medical officer them. All they know exactly who that they can at the district, and then they closely monitor them so that if we get any case, we'll be able to respond to them very quickly.
No, Mr. Minister, the issue of these pilgrims that we come and screening them, is it that there is any sign of Ebola again, whether it's in the country or neighboring?
Not so Ebola, COVID.
So COVID.
Well, again, Senegal just recorded about 78 of them pilgrims and test positive. Cameroon reports similar numbers. Togo reports similar numbers. So as then here they go on, they get an abundance of caution. But again, Hajj now a very celebrated thing. That's something we really the pride we have in people and for go Hajj and come back. So we don't want to turn a celebratory thing into a nightmare. So what you want for do now for make sure so we follow the science very closely, but we do it with dignity and respect, and make sure so then people move smoothly, then go back and celebrate with their family then.
Okay, continue for the with name now Dr. Austin Dembe, Minister of Health. We just start for take with you on the things that we don't happen in the well body sector. The program Good Morning Salon they continue, and now we go for a break.
Do you know you can transfer money by airtime and pay all your utility bills in just a minute? You can have access to your account anytime, anywhere. Welcome to the world of fast and easy GT World. With the GT World, you can transfer money from one GT Co account to another, pay utility bills, get account statements, get airtime, and check your balance. With GT World, you can buy Excel anytime, anywhere. You can go to App Store or Play Store on your iPhone and Android devices, download the app, and enjoy. GT Co. Wouldn't you rather bank with us?
The program Good Morning Salon they continue. We will bring this edition come to you this Monday morning. Me Nasapti you Kalon.
And Musa Kamara Naminim. The program is still listening to our Good Morning Salon, where they come to you from the Society for Radio Democracy 98.1 FM. Before we come to with Victor Lansana Kurma, Executive Director for Health Alert In, we still deal with the Minister for Health. We now Dr. Austin Dembe are very careful and not put sanitation day because it don't depart for long. But now we look at, apart from the COVID situation and the test them on they run for them, pilgrim them where they come from Mecca this year, what in the happen at the health sector in terms of for give strength to the sector as we mentioned earlier?
So I mean, something very, very transformative to go on at the health sector. Again, something in the way the public now they see, and something in the way the public they see. One of the things that the public now they see is that we don't move away from disease-focused interventions for focus on the person. All 8 million of we. And the way they do, I will say universal health coverage, which means say everybody foresee themselves inside the health system, and the health system foresee them. And the best way for do that, and they will follow the life stages approach. The life stages approach means say, we start with Bella Woman them. All the Bella Woman, all 300,000 of them every year, we make sure say we do everything for every Bella Woman for make sure say it remain healthy and it delivers safely. At the same time, when the picking unborn, we therefore go beyond that notion of survival, because we do everything from when the picking at the womb till it arrives so that it will arrive safely and strongly. We want to support this part picking so let it go from survival now to thriving. For everything where the picking need, till it ready for school, so it ready for be school ready, till it go kindergarten. Till this picking goes school, where it goes school now, we responsibility now for say all the school picking them, we make sure so they focus on learning. And if then they focus on learning, we know why let them begin deal with malaria, then begin deal with vaccine preventable disease, then begin deal with AI, then the CNA. So all of we health intervention, they focus on the school child for ensure say he ready for school. Till we go to the adult, till we go to senior citizens. So they follow the life stages approach, the life course approach, and we don't begin to see fantastic results. Just starting with the pregnancy, the kind of reduction we don't see in maternal mortality, it's just incredible. The kind of drop we don't see in child mortality, and increase in child survival, and increase in vaccination rates, it's really incredible. The introduction of school health, now they can begin to see some real dramatic shifts, dramatic changes where they occur in life. We don't introduce some new vaccine them inside strategically. For example, we work on eliminating cervical cancer. Cervical cancer, we feel say a three-step approach. First, you get a firewall where they use with the vaccination. Second, you use early detection and treatment. Third, you use advanced treatment. We don't introduce the new vaccine, the HPV vaccine. When we start with about targeting about 50,000 10-year-olds. Where we start in 2 weeks, we vaccinate about 84,000 10-year-olds. Now we don't introduce and deep into the routine services. We also just introduced the new malaria vaccine. And the malaria vaccine for Pekin and pregnant women as a focus, not to just the vaccine. We don't order about close to 5 million insecticide-treated bed nets. So when you combine the bed nets with the vaccines and the early treatment and diagnostics and care, first of all, we'll bring malaria rates extremely low down, and with a tracker. And for example, right now, a few weeks ago, we start the new press track.
Okay.
Press track the Cumbra.
Mr. Minister, they come to the new transformative initiative in the dual body sector. Well, I take you a bit back inside 2022 in terms of making sure that healthcare service reach everybody in the country. We soon start for do an outreach. We soon roll out a mobile health buses way for the gonna different side them for make sure say they able to attend to people who can power body business. What really happen to that particular initiative there?
So the mobile bus now just really one brilliant idea where if you say for take the healthcare to as close to the people as possible. So we will get a partnership with the Chinese and then give you 4 of them bus here. And which will be do now for take them bus here, go district by district. I think so we want to see over 30,000 patients. Any side with the bus, they go all man they can. We don't learn a lot from the bus there, not only the service within they provide, but the crowd within they attract. First man in the go hospital. Yeah, mostly woman them and then picking them, woman them for themselves and for them picking them, and then much more frequent at the hospital. The man person get major trauma and get accident and get heart attack. But the bus, it attract an equal number of men, women, and children.
It's still in operation.
The bus still in full operation. I'll tell you something about the bus. The bus for let it go out, it requires phenomenal amount of resources for let go out. Yeah. So imagine them buses. So first, the odds. The bus on the odds. They run completely because you get to run all of the equipment with inside. With the bus, they go, all the drug them all they use now free. All of the tests in the test kit then now free. So it costs close to $25,000 to $50,000 anytime we them bust and they move out. We've been very fortunate during COVID because what's been happening, we've been getting plenty of resources from COVID. We've been use the COVID resources for expand COVID vaccination. But as you expand COVID vaccination, it gives opportunity for take them bus here for go as wide as possible. We don't run out of the COVID resources now. So what they do, they find new partners, for able for help with or move them bus here, go forward. At the same time, we get for change them, we get for reconsider the model. Because what they say free healthcare, now free to the person where they can receive it, but somebody need for pay for them. So like I said, it costs nearly 50,000 for let them bus here go out. We work with the Chinese partner then for see if we can expand the fleet of buses, get another 17 buses, but change the model. so that the bus are not going to go far away now. And then at each of the district, then they move around the district. It will be part of the hospital network. So again, with the struggle, again, for be honest, with the struggle for move them buses, yeah, and every now and again, with the work with the partner them provide resources, we can move them. When the government they provide some of the resources, so we can move them. But it's very difficult.
Now everything of the health cleaning buses they install.
No, it go on, but they go on as frequently as structured as last time, because the plan we get the last time. Now for let them go 2 weeks out, then come back for 2 weeks for replenish and resupply and maintenance. 2 weeks out, then come back. We know they do them that frequently anymore. And again, the season not they help either. But with the raise money, with the talk to partner them, and we'll raise enough money, we just say this the NTR. So it, like I say, it go over and beyond the individual service. For example, we see say some community day, we then see say a lot of people, nearly 30% of the people over the Canada bus then get high blood pressure, they don't know. We get some community where 20% of the people already come to the bus, then get diabetes, they don't know. We find all kinds of things inside the community. Well, wait a minute, if you get high blood pressure, now the community, you don't know. The time we they show up in the hospital, now with catastrophic failures, with stroke, with heart attack, with kidney failure. Well, we know how that only happens. So now with this bus, they go out, we try for follow-up with health education, for make sure say the community participate in their own education. For example, high blood pressure in the early stages, easy, but it can be managed by diet, lifestyle changes, exercise, and some drugs as necessary. And if you do that, it prevents the catastrophic failure with the canal. You also, if you not do that, if this bus not being they follow, will go out and detect the NTR. The only time you go see them, the only time you go see them now, we then get this catastrophic failure, we then show up at the hospital. So again, the Boston are success, a tremendous success. We'll try for raise more money for able for run them. We'll try for raise more money for get more of them buses here so that then will be stationed at each of the district then.
Okay, continue for stay with me, said the program Dr. Austin Debi, Minister for Health. Today's edition of the program Good Morning Salon, we look at the well body sector and things that the ministry don't do for improve this area. We want to welcome again Victor Lansana Kurma, and the Executive Director for Health Alert. Good morning and welcome to the program once again.
Thank you, Musa, for having me.
When I don't observe and don't work in the health sector as civil society for a very long time, as it stands, what's in our assessment of service delivery in the well bodies area?
Okay, so in my opinion, honestly, a lot don't happen at the health sector, a lot of turnaround there, because we did do periodic assessments from year in, year out. Let's start back. Me, one picking from 2010, way back where the free healthcare was launched by the previous government. And we done the follow-up because our organization Health Alert established since 2009, just before the launch of the free healthcare. So we done the follow-up and see the things that they happen within the health sector. We monitor, we engage, we do a lot of dialogue, policy dialogue, advocacy. We also do budget tracking which is also critical because for we as civil society we believe say the health sector not gonna go without resources. And let's not forget say government also be done signed to the Abuja target, 15% of the Abuja target. A lot of other countries don't they do a lot of well for try for get down there, but we still get challenged on our partner. But of course some efforts is being done by government and the partners them. And we don't do a lot of sensitization. We also do training because important for we as a human rights organization, we believe say health na a human rights issue. And so therefore everybody will lay hands on patients, if you understand for they get that human rights lens, for they know say na matama they do it. And so you have to be very careful, how they do them, because one thing, any mistake we do, that mistake they not only create tell or mistake. Say we tell a mistake by your style and another style and no with life no when you mistake now death. So all them things they will bring that to the attention of the health workers. Will they train them what they call the right based approach so that they will know say when patient come at the hospital you focus for me to the patient, because now health now in life it do it and now you it depend on. So they do all them things and of course policies that we get for improve on the health of the patients. And we also engage the policy makers them for make sure that them policies and they work very well, you know. So all the activities then now that we don't do mobilize, for instance, like how the minister they talk in terms of issues around pandemic or any epidemic or even any emergency situations. You know, we also they jump on board and work with the ministry for bring the citizens awareness to the citizens, you know, based on the situation where arise.
Will they go for short break? We'll come back with the join you for tell we you frank assessments na the sector. In name na Victor Lansana Kurma, Executive Director for Health Alert. The program Good Morning Salon, they continue to go for short break.
UTB, Union Trust Bank, the game changer don't come. As we the lead, others they follow. And just with your mobile phone, you will transfer and receive money with ease, speed, and safety. UTB don't make it possible for collect money na ATM machine without the ATM card. Now that we call cardless ATM. You, the UTB customer, will send money to anybody and deposit and collect the money na any UTB ATM panel without any ATM card. All it can do now for just enter the reference code and collect the money. The UTB copper in safe day. With this UTB copper, any UTB customer can transfer copper with a mobile phone to anybody up to 5 billion loans. And with the reference code, the person can go to any UTB branch and collect the copper. Union Trust Bank, we there for you.
The program Good Morning Salon they continue inside this edition of this program today. Radio Democracy, they assess the health sector in terms of effective delivery power body business. And before we go for that break, there will be the talk to a civil society representative Victor Lansana Kurma, the executive director Health Alert. Before we go for the break, me co-presenter will pose a question to you for sincerely give a clear assessment on the well body sector. I will take step by step, especially we will look at the transition of the name for Ministry of Health and Sanitation. What do you think about that change, the removing sanitation from the health ministry?
Well, now a very good idea, but of course for me, the body is still on the ministry, even though you see the sanitation components don't go to water and sanitation. But I think the ministry gets an oversight function and get a very huge responsibility, because you know over the period we all see what the sanitation situation has been, and why the link they completely remove sanitation from health. Because first we look at primary health care, we look at sanitation are one of the factor where most times they contribute to somebody patient being sick, we go resort to clinical treatment. Right? If this sanitation not good, somebody go contact whatever it is and try to get diarrhea or get other things that way they contaminate and whatever. Also get for end. Now hospital get for end. So that link there, if for be very much that nexus stay for be very strong, between the two sectors them. And so now I think say that body in the ministry no go totally pull handy, because they get for oversee what thing they happen. Because at the end of the day, the board get for stop to them when somebody become infected as a result of poor sanitation, whatever it is. So that is good. Me, the other way how maybe they look at in the past, maybe they look at and say, instead of removing the sanitation component, like how the ministry, we don't get two ministers, for instance, deputy ministers, one minister for the clinical, the other minister there for sanitation, right? But of course, me not to the president, so it's the president your wisdom for things say for removal. But me feel say still the ministry get the responsibility, and not only the responsibility, but they also even get the burden back, because at the end of the day, like I said, the instance where they give so now to them back the burden for stop. So if they just not pay that oversight and just left everything in the hands of water resources, at the end of the day, when they cases then we get for the camp as a result of poor sanitation, the burden get for the on them.
This rainy season, and most times during the rains, then cholera outbreak happen. What do you think say, or would I think say, get for play that role? Now sanitation or the Ministry of Health in terms of prevention?
So in terms of, I don't know how the structure done there, but I still emphasize that the Ministry of Health, because you know what, minister will agree with me now. I say when cholera begin hit, the they relate them to sanitation, poor sanitation. When other whatever disease will happen, we related to sanitation, they're not going to look at water resources. So the same Ministry of Health. Now in the traditional ministry, everybody they look out to us. So for me, whatever the structures are, whatever the systems, so they don't work out, it's good. I don't get a problem with that. That's a political decision. But for me, I think say the minister should be able to know, say, like I said, emphasize, say, therefore play oversight function. Because at the end of the body rests on them.
And I come to you quick on your assessment. Make a come to the minister again. In terms of oversight, like what you mentioned, if cholera outbreak during rain season can happen most times, possibly pray for them, but prevention method get for the who do oversight this aspect and whose control or whose supervision role una get over the sanitation aspect we don't come on down now.
So, and maybe I don't like this phrase, don't come on down. I mean, this is now one government. Now, one government and the ministry, and they work together. The minister and a very strong colleague of mine, we know they provide oversight, but we work collaboratively because what's happened, failure on them part go impact we. Failure on we part go impact them. So again, I think it's an opportunity for collaborate, now for opportunity for expand. I mean, we main public health role now for prevent the NTI from happening in the first place, but at the same time we prepare for them, and as we prepare, and so they're ready for respond. Yeah. So in the case of all the environmental impact, like cholera, even with malaria, we work very, very closely with the sister ministry, water and sanitation, and we make sure, say, when problem come, we coordinate, we collaborate, we communicate, and we solve them together.
So in terms of the cholera issue, where my co-presenter asks you, how much on don't prepare? Because we see a neighboring region country, Nigeria, they experience that now in terms of cholera, and we see the WHO don't get a measure and things are waiting for put in place. For Salon, we're now on preparation for just in case of such emergency, Mr. Minister.
So first then, with the NTI, they scramble. Yeah. Well, now we get a whole agency with their whole responsibility now for letting us not see them. Their whole responsibility now for letting them not visible. Because as how now they see them now, so then they work effectively in terms of the preparation, which you look for now for make sure so you get diagnostic capability where they all side, which you look for now for get early warning system with triggers. Which happened, the National Public Health Agency get waiting and call field epidemiologists, and with a non-trained and embed Boko country then get 40, 50. Yeah, so we get over 350 field epidemiologists that we embed inside the regular primary healthcare program there, where they look for any unusual event and a trigger warning.
So you answer with so much prepare and then don't get all what it takes in the health sector for any emergency such as cholera or any other one?
No, the whole agency therefore.
Okay.
So we will again the proof of the pudding, the kind of eating, yeah. In 2014 we get a major outbreak here of Ebola, yeah. Say 2021 we get a major outbreak in Guinea of Ebola. We see any one case now. Not by accident, now by how prepared we did and how we're able to respond. So I know they say cholera no go come out because again, when you get the alert from all sides, with the heightened readiness. For example, with even this Hajj business, when they come back to the Hajj business, the fact that Senegal records 78 cases of COVID, it heightened we preparedness now. So now I make we able for tackle them. We're not over it too. But we're able to tackle them. So again, and we're very lucky for get Brigadier Professor Fodesa for head this new agency, and I don't know if I know Professor Sa, but now the one person we're responsible for reducing case fatalities of Ebola from 98% to less than 50%. 90 head this agency, Nasalon man.
Continue for stay with you. We come back to you, Dr. Austin Dembi, Minister for Health. The program Good Morning Salon, they continue.
And inside the program now, we look at one of the headlines to them as this BNTM. The Anti-Corruption Commission will open investigation on 3 Motokadem, with the first-time Chief Immigration Officer Andrew Jaya Kaikai for Sekatri Mutkade will be received as gift from one American Lebanese man. Well, the ACC don't end this case, and according to the Director of Public Education and External Outreach at the Anti-Corruption Commission, Patrick Sandy, say they drop this case because they don't find any corruption on this case. Well, he talk more about this, also I believe updates on this case, as Patrick Sandy explained more to Musa Kamara inside this interview.
Well, basically, now for inform the people of Sierra Leone that we don't done the investigations and that we don't come to the conclusion that the issue around prosecution no go obtain, meet a prosecutorial threshold, because we find out, say, in the course of the investigations, Andrew Jaya Kakai do the declaration, asset declaration form, also do the declaration at Parliament in the form, but that there was no gift register existing, just as in other MDs. And then the Act make provision that that gift register has to be prescribed in the form in which it was by the ACC.
When I done the investigation, the case not reach prosecutorial level or get merit for that. What exactly you mean?
No, in simplest of terms, the case is concluded. The allegation will come now been around the 3 SUVs where it say it received as a gift. And by procedure na ACC, when an investigation come, particularly of that nature, you therefore issue out notices because you want information from relevant institutions and people, especially this we therefore do with gifts. To start with, we issue the notices to the Clerk of Parliament, he respond to SLRSA, they respond to the Clearing and Forwarding Agency, to the Shipping Agency about these vehicles and Kawan inside Sierra Leone. And then we also been therefore contact the individual where we understand, say, give these vehicles as gifts. And we talk to the person confirm to the ACC, say, yes, na ingi them vehicles to Jaya Kakai as gifts because he don't do work for him. He's a lawyer, and that it just give him as gifts and in gratitude for the support where Andrew Jaya Kakai be done do over the period of time.
With this verdict from the ACC, waiting at the fate of the Mutkaya now?
No, definitely the vehicles can therefore be returned to Andrew Jaya Kakai because it lawfully blanked him.
After a long investigation, when I don't conclude, say, case no there against Andrew Jaya Kakai and for receiving Mutka them back, when they pay any compensation to Andrew Jaya Kakai?
Not necessarily, because now an allegation will come and we get the powers for investigate. The act give you that responsibility.
For so long now, we do interview with regards this matter. We don't ask Uda give these gifts to Andrew Jaya Kakai for a very long time now. And you don't start for say being in lawyer with Andrew Jaya Kakai the same way they na the US. This person will give this gift to not find any connection with Saloon or any business with Saloon.
We able to establish that yes, whilst it been there, Andrew Jaya Kakai been there in Texas, they've been there in communications. But for say we able realize anything directly connected with Sierra Leone, no. We just know say the person a Lebanese American.
What in the ACC they look at before then take up a case and regard them as one we need for be investigated? I ask this because we see a pattern recently. We say the ACC now the latest and the Jaya Kakai after another investigator almost for a year when I come out say get case for answer. And the ACC self be the investigate matter we get for do with the managing director for the Salon Commercial Bank, and at the end of the day say get case for answer. And I mean the same for the then Director General for the Salon Broadcasting Corporation, Joseph Igbenda Kapua, come out again say Joe Igbenda Kapua not get case for answer, but rather a system issues. The case or the examples then go on and on. Make I ask, what thing wanna they look at before wanna go into a case?
This is a very good question. We need for educate the public. Firstly, we need for understand say investigation not necessarily means say you don't ascertain guilt. Investigation now for lay you prove or you disprove the allegation we don't come. And after the stage of investigation, waiting again you need now for lay you get evidence where they reach the prosecutorial threshold for criminal proceedings. So for let a matter be reported to the ACC, firstly, if it fall within the mandate, within the offenses that the act as alleged, then we investigate. When we investigate, then we now able to find out the issues around waiting will be the investigate. For instance, in this particular case of Jaya Kakai, that be around gifts. So you want for know, firstly, would I give the gift, and the circumstance around the giving of the gifts. So, but we don't look at all of the other aspects, even in terms of declarations where it don't make, and where also the ACC don't make the sufficient provision to MDAs for get gift register, where he did not, day with an MBA, particularly like immigration department, day. But it fulfill a lot of the requirements. So in that case, go say the matter reach prosecutorial threshold for let you charge to court. So you're able for no say this matter we not can go court. And the same like for the MD of the Sierra Leone Commercial Bank. It does not necessarily mean say once you investigate, you say case not there, so you not get for court. Like in the case of the MD, we don't refer to the chairman of the board, because when you go to court, the burden is so high, especially in criminal proceedings. So we take our time for CC. We go to court only with matters who say with the secure conviction.
Is it that we're not afraid?
What are you afraid?
For proof, as you say, the burden high.
No, yes. The point is, what is it that you get for going to court with? Not to fear now and then. You don't investigate. You want evidence, and the evidence for reach a level before you go court, and you not get up. So which fear are we associated with that? There is no fear at all.
Plenty top government officials, they go off the hook of the ACC scot-free at the end of the day.
I disagree. Naimeka, they also say scot-free, but it is not about being scot-free. Now, the process of investigation and the outcome. If the outcome comes because not to sue them one time, then I don't think we have to do otherwise. But people for understand say, would they do a credible job? If you do an investigation and the investigation points at this, you're not going to do otherwise.
Well, that's now the Director of Public Education and External Outreach at the Anti-Corruption Commission, Patrick Sane, interview they talk to Musa Kamara Osai. He said they don't drop the case of the first chief immigration officer and Jaya Kaikai, as he said they don't see any corruption in this case against Jaya Kaikai. The program Good Morning Salon, they continue. We, with the Winnie's edition, come to you this Monday raining morning. Me, that's up to you, Kalon.
Musa Kamara, name your name. Inside the program Good Morning Salon, we go for a short break.
Any hour where you sleep and wake, you dey ask yourself, wetin GT Bank get for we again? Well, GT Bank gladly for tell you say anybody can do MoneyGram and real money service na any GT Bank branch near you and receive gift wey go make you at gladly. E no mean say pass you be GT Bank customer. E like you not to customer na the bank, just waka go na any GT Bank branch near you and do you real money or MoneyGram service and receive fine gift from GT Bank. GT Bank, it go better you bank with me. You don't try no do better. You don't try no
the program Good Morning Salon, they continue. They country from 98.1 FM. We see Victor Lansana Kuruma, Executive Director, Health Alert. Today we look at the well body sector and service delivery this area. So we don't get Austin Demby. We don't talk on and also for the second time we come to Victor Lansana Kuruma. In your frank assessment of the health sector, how you can assess them and what do you think of the well body sector as it is now?
Okay, so few things in the way probably I want for analyze, because over the period we don't engage the media and the public will get serious concerns, and I think they also come to the attention of the authorities, of course the minister and the team. When we talk about assessing the health sector, generally we get indicators we probably one look at, and we know to the masters and people therefore analyze their indicators, and we now within the public they raise as a concern. Now we look at, right? Because over the period, then they say Salon be on the bottom under the UNDP index report because we've been getting high maternal mortality. And so Master Sabi people there with the minister and the team don't they indicate say then they don't they reduce drastically, which is good for we as a country. But of course we still get issues them where we still need for address. Now over the period they do monitoring. Some of the things that we don't look at where the community they raise to where and we say they go to the facilities then we they see for we self. Now the fact that Then challenges and the body in the stick out to the people. For instance, we do a monitoring 5 districts: Bonth, Pujal, Tonkolili, Falaba, and Kwenadugu and the likes, where they look at if one of the projects where the Global Financing Facility, the fund within the World Bank funded project. One thing we come to the attention of, we report now that the issue around referral is a big challenge. In fact, not only then district and right across, we still notice ambulance system where government don't provide. Like how we get during the COVID, we've been acquire some of the ambulance, and the way I remember vividly, the president began for distribute the ambulance and they right across. But as we speak, we're not sure whether up to 50% of the ambulance that they function now. You go now, most of the facilities, they in hospitals, government hospitals, you see the ambulance and they pack. So we try to engage key people. For instance, we try to bring to the attention of NEMS, because we know very well, say NEMS now be one institution where now don't they run ambulance. The question will go and ask, what happened? For say money not did the ambulance again, they tell the money be there something $1 and be there and make NEMS be look very attractive to referral. Because we get reports whether they, of course, in our social accountability meetings, we'll bring all the stakeholders and the council, the DMO, they all people confess to we that then they pay for the ambulance services for referral, for instance, from from Matrujon for Gobo. Then they ask them for pay 700,000. Then they forgive the driver 200,000. Yeah, as stipend to the driver. This not for fear. So we begin ask, is this body now being shifted to the patient or waiting? Because the public need to be clear as to whether now their responsibility that, or at least let we know, say yes, no, NEMS not they run the ambulance service again. So Ministry of Health need to explain to we why that body has been shifted to the patient, right? We are not very clear about that. That are one issue we're very critical. Again, when we engage the Ministry of Finance in one of the budget discussions, while that thing will come out again, now external referral, for instance, external treatment. We also notice the Ministry of Health, one of their budget line is very huge on just external treatment. And I think in those discussions, even the Ministry of Finance raised the concern, Ministry of Health, why is this so huge? Why? What is really responsible? So when they talk about improving health status at a country level, now would that in the benefit from the external treatment there? Now me and you or what? We really need to be clear with this. The public need to also understand. Thankfully, the minister didn't. But that day, now the budget where the Ministry of Finance also erased that concern. Right? So what are we doing in our country for reduce and then kind of external or international treatment? People that when they go out, where they take huge chunk of we budget line at the Ministry of Health. We also look at issues around drugs, stock out of drugs. Now be another issue will come out very clear in most of the facilities. Then we at that particular time there were no drugs, and so when you engage, the issue has always been what's relating to stock out. Now distribution at last mile has been a challenge, and what's responsible. You talk to the councils they say, "Oh, we not get budget line now. Now we budget for distribute drugs." Them now the Ministry of Health, in fact. In several of our engagement, social accountability engagements, the councils and they say this issue of devolve, not just by rhetorics, not just talk now much, but the Ministry of Health is never devolve. Everything did at the central level that they dictate and they do this and they do that, and so we councils then we just don't mind these are. So again, somebody needs to understand that, right? Because these are statements where they come up from. Like how minister they say we complement each other, but then if council they say we talk about devolution, even the personnel, even this, even that, all still in a national level, not to we. Then are people just trying to escape or shift responsibility to other people? This is something we need to be very clear about, right? So now a big challenge, like I say, last mile distribution of drugs, that be a big challenge, and I don't know how the minister will respond to that, but it's still a key issue. Of course, we'll talk about the attitude of health workers. Now, one thing where I want to relate to the attitude of health workers, now the issue about PIN codes. The issue of PIN code will come up as something we're very challenging. I don't know, thankful the minister is here for tell the public how do they distribute PIN codes. wouldn't they give priority? Because again, to the health workers, when you talk to them, they tell you, we don't know how PIN codes are distributed. We don't know whether which metrics they use or which criteria they use for that we get, in one of the engagement, for instance, at Kailan self, the district health sister, it not be able to respond instantly. Say, no, wait, like, contact the module, I don't can talk something, I just know. When civil society, we say, no, not to say win and witch hunt. We just want to know, tell us what are the challenges. How much PIN codes they want to receive? How many people them? What are the criteria where they use for them to get PIN? All of them question we ask them in our social accountability forum, right? So, like they say, these are issues them. Despite the progress, the significant progress will not happen within the turnaround will not happen within the health sector. But these are issues we would need for bring them to the attention of the minister. He might not be aware, or some of them are aware, but then maybe he gets away while we will make it very clear to the public.
Thank you very much, Victor Alassana Kuruma. Inside the program, before the minister respond to then concerns them, as he don't pen them down, we get for do with drug distribution, ambulance system, electricity in our hospitals, and other challenges them. We could listen to the people them we then can deliver them service for within the makeup of the well body sector. We join Kabia quick on this.
The health system for long term now don't get plenty challenge inside the past year in the country, and malaria, HIV and AIDS, maternal mortality rates, and other one them. Don't be one big area outside governments only get plenty challenge. For address them challenge, make governments be come up with universal health coverage. With this now for say people get access to medical service in the country. Where this make President Julius Maada inside in first 5 years we make the health sector as one part in main priority area them and safe inside the People's Manifesto where it be used for campaign inside 2023. We make the health sector again as priority area. Where this according to the president. Now because of the gain them, where in governments don't make now this sector. President Julius Maada where he may launch the People's Manifesto, been start first for talk about the gain them, where in governments we don't make now the health sector.
Sierra Leone has improved and performed better on most health outcome indicators in the healthcare sector than most regional neighbors over the past 5 years. For instance, with a 60% reduction in maternal mortality rate, fewer women now die during childbirth, and more infants grow up to see their 5th birthday than 5 years ago.
But how this sector gets for work inside President Bio in second term na office, President Bio explained.
The second initiative is human capital development for nurturing skills in the 21st century. This initiative will continue to build on human capital base, invest more in healthcare as a key driver for a productive society, and create equal opportunity for women across all facets of life.
What do people think about the health sector in the country?
The hospital there now at this past you get enough money for you able to take sufficient medical, and once you see no get money for make get good medical support, it no go easy.
I don't know if the implementations or government they put the staffs there or the nurses there or the doctors there, they will implement them. Because the reason why, what in government they say, then we're going to hospital, what they meet are two different things. So this make I feel complicating. Like it's certain prescribed certain medicine for you say, where you go, this medicine not there, but at times it can be inside the bag and sell and go buy for you. At the own price now where they go buy is a very expensive compared to what then they will say the government they provide. The other tablet then they go now for the malaria treatment there. At times we be see them for dinner at the hospital. At times we go there, then we tell you say no they
patients and they die. You the all money for let doctor see to you, pass you go and bribe. All land there is not necessary in the country.
When they talk about free healthcare now, you know and they talk about where you go, you know because Panadol maybe for let get I go tell you say government not supply with. So me assessment and office say things okay with the health. Government need for do monitoring so people learn. So the one day they work at the hospital. So me and your assessment and
While the health system in this country not easy, oh man, no lie, because from belle sef wey dey pana, wey dey go join clinic, if you no hold them 150, no go able join clinic. The every day wey dey go hospital, get for hold like then 90, 80,000 because get for spend a lot. Panadol sef na Panadol we dey buy, and no go talk about pregnancy care now. Wey dem say dem for give we, but dem no dey give we, na buy we dey buy am. You go see pikin hospital, oh, na a lot of challenge you dey face. From the table then now, take enter na the office, so they get medicine, na buy you dey buy them.
Then people here been same way so talk on our government need for improve this sector.
We need more people for can be for the hospital in our country. Correct now, you know easy.
One thing they try for say no more. Anyhow we look at government they try, but na me too go push this country because na me too responsibility for you to see the way forward of the country. So if me too don't willing, don't ready for put things in place, we will able to fix this country. But with the plea to government, let them more work harder on that side. Let them able to try for put things in place and fix them up. You cannot say system they what they need for put in place. At least let the end cameras there for implement system. That camera what they put, think it will help. When they go, they catch one or two, then set example. The other people in the field. But if they left and so no more, they not put camera for able to implement them. At least let them able to see whether they corrupt or not. But if they left and so no more, nobody business, now the more thing they go worsen.
As far as me know, the assessment so far of the health system under President Bio, I would say a little bit, some are improving because if you take a look at, we get some amount of infrastructures that we don't come up with regards to hospitals, builds, input local, 34, and other districts that we hospitals that we not been there, some been there, some don't improve on them. So I would say that now. It's positive change. I will even say that a positive development on then infrastructures and day.
Then people here end up calling government for give more support to the health sector so that salon people and say go benefit from the well body sector, more especially the free healthcare service for radio democracy. You know,
song inside the program. Good morning, Salon. No see somebody at the house is celebrating birthday, and today na Sabtu.
Today we celebrate one of our own when Mastan Soiree
Aja Mastan Soiree.
Exactly. Twin mama. Well, as you all don't know, this song definitely now for say happy birthday to Mastan Soiree on behalf of management and staff, and also all you want them with the EU, Send Salon, Naxa, what's your ad?
Audit Service
Salon, and the other side, they all.
And we invite Mr. Sawane for join we in the celebration at 12.
Exactly. So at 12, all them people don't call from them different institutions. Now welcome to Radio Democracy as today.
Bramatogo Foundation don't invite them.
As today Mastan Soiree celebrate in birthday. So on a come 12 o'clock. Hello John Mastan Soiree to celebrate. On behalf of management and staff, so they say happy birthday to you, Mastan Soiree Mrs.
The program Good Morning Salon they continue, and we come to the Minister for Health. You don't get from Victor Lansana in concerns them, you don't take note, and you don't get from the public. The issues them we then raise are the issue of drug distribution, ambulance service, light system in hospital, the well body workman and they sell drug secretly instead of publicly, and also the difficulty for access health experts where you seek. These are some of the concerns there, and major concerns then we come up from Victor Lansana and from the public who want to implement the programs then for. Yeah. You respond to them concern now.
Well, thank you very much, Musa, and thanks, Victor, and thanks to all of the concerned citizens. Again, we not to mirror to ourselves, we not to see ourselves. Now, other people then they tell we waiting right and waiting wrong. And so we really respect civil society for their input here. We respect the public because at the end of the day, now for the work, then for tell we if they're satisfied or they're not satisfied, waiting in one of them. Now we responsibility for change and for able to respond to them. So you get about 5 points that we raise here. So I'll try for hit really quickly. First, on the NEMS service, the National Emergency Medical Service. Now, the primary ambulance service this not the country. At the same time, you get ambulance service there with the inside hospital. You get ambulance service there within our private sector. You get ambulance service there with the institutions like prisons. One of the things that I noticed say now the NEM service get about close to 80 functional ambulances there. A few weeks ago, I give them an additional 10 ambulances where somebody donate to it, brand new ambulances. And NEMS get the system where then they look at maintenance of the ambulance, then they look at fuel for the ambulance, and which you happen we want for ensure say not to we possibly need ambulance for go spend money for buy fuel, not to we possibly need ambulance for look at maintenance. All of them also need for day in advance. So we work with NEMS and ensure say they get all of their services here. We get some money from the World Bank. We get government, Ministry of Finance, to directly fund them. We want clear so all check the way you do them for let them get them resources here available.
Before you come to the other points, quick clarification on the ambulance system.
Even the ambulance, the struggle they get. Now when you get ambulance, then give hospital, then give district, then they're not able to maintain them. Small tire bust, they're not able to fix them. One windshield broke, they're not able to fix it. And then they run the ambulance till it die. You know, again, it completely unacceptable. So me, I want to stop this fragmentation of ambulances and work with one NEMS service. We go able to get GPS system, we go able to get management structure, we go able to get fuel in advance, we go able to get maintenance culture, we can manage all of the fleet. Now we get very, very good cell phone penetration throughout the country. You get a 117 number where they truly function. And if we're able to combine the 117 in a fully functional NEMS service, I think so we go solve the ambulance issues in this country. But the current fragmentation, it just not the work. It's just not the work because again, the other day I see them, they get accident and a rush going at the place. But it's all see them, ambulance arrived and say it come up from somebody, some mayor from some city. The ambulance car, not just a shell of a vehicle. You know, get staff, you know, get oxygen, you know, get support inside. How you go call that ambulance?
Apart from the 80 ambulance them we see NEMS get, how much the Ministry of Health get on the you for run the system? I ask this because I remember the last time we, for instance, Port Authority then get accidents in the road, unless ambulance come up from Bo, can't take them close to mile 91.
So with the dynamic I say you will find out we get NEMS not to private now government institution. Yeah. So Ministry of Health not get ambulance on their own.
So that 80 way NEMS get now the old ambulance that the country gets?
No, now the one way NEMS they manage. The hospital themselves get their own ambulance. The other institution then get their own ambulance that within they manage. In some cases, not as well.
Now patient they get right or they buy fare for ambulance or the hospitals then?
No.
In a situation this happened.
It completely unacceptable. Again, you know, I know we did an accident early on ago and you say, let me go come buy a fuel for ambulance for me. So what's going to happen? The ambulance structure is supposed to be such that you get advance payment where the government they pay, the partners they pay for fuel. Yeah, but when you get a fragmented system, it just not seem for the work. Me want for collapse all of the ambulance system into one manageable system with a good 117 support system, with a good GPS system, with a maintenance culture and a fuel availability culture. You can get a single payer arrangement where the government they pay or partners they pay, but that payment get for the in advance of the service. Not to at the service. It's not fair for them to put this at the expense of the patient. So that's something that why they work on. I mean, we they consider all kind of options, including privatization of the whole service.
So what about the area of concern where some people say that they pay from one table to another, then just get for something where that not supposed for be for access to the health.
So we don't know with the
yes, yes, because you're really concerned them for people with
so the other issue now is just corrupt practices inside the hospital. Again, we get zero tolerance for corrupt practices. That's everything that happen. You get free healthcare. Free healthcare now for lactating mothers, babies, vulnerable children, Ebola survivors. Of a small group of people then, where the government they give free healthcare for. What's going to happen? You get a lot of people that we not qualify for healthcare, like me and you now. So we're not a pregnant woman, we're not a lactating mother, you know, but we still need the care. So what you would try to do now for build a PPP, public-private partnership, where you get a pharmacy inside the hospital, We get standard drugs. We get price control associated with it. You ensure say the all of them product and they up to date. So we don't begin pilot that. We don't do that in a Connaught Hospital. We don't do that in Port Local, in Bo, in Kenema. So we did completely change this paradigm such that now you get a private sector. We get a deal with the government. We're able for supply products. We're complementary to the free healthcare products. With people that we don't qualify for the free healthcare, we will forget access to that. The third component of that now, we try to build health insurance, where you go pull the resources. So we get Slushy, where in the next couple of months, I think we go formally launch Slushy. Slushy, they allow you for pull resources. We go allow people that we not qualify for free healthcare. We not get able for pay out of pocket. We go able for use the insurance scheme where they don't pay for in advance, so able to provide services. So that way they would look
what
at
about the challenge for access, expert doctors?
Okay, so that's a really important question. That's not the international travel where people they go overseas for international help. Again, what's in the happen? We get a panel of doctors that will evaluate every case for see how serious the case they if we're able for manager now for see if they qualify for let them go overseas. Right now, we pay over $2 million a year for their overseas travel day. Mostly they go Ghana and India. We want to stop that because what's in the happen? We they pay for let them go build the strength of Ghana, let them build the strength of India, then capability where we know able for build our own strength there. So we want to convert that money there for able for build we own health facilities here, for build we own health infrastructure, for get postgraduate training now. So and for able for because right now it costs we about $22,000 for support one person for go overseas, whereas it costs we $46 for one person now for the healthcare per capita. So we want to change that paradigm. Now make we build new hospital them. Now make we build new expanded postgraduate training. Now make we right now, in fact, we build one new hospital in Kerrytown we don't secure about $50 million for. Now make we get this Normally hospital. Now make our defend funds for able for establish a brand new $100 million hospital like Jembe in the middle of the country.
You say plenty of people in the go overseas for medical. You that among them people in there or now they do test?
Of course not.
Now they do medical.
I've been sick now, so a couple of months ago, yeah, and I go. I get tests, I go Choitrams, I get tests, I get an MRI done, yeah, so I get the best doctor then.
So all the treatment government hospital as they do?
All my treatment in Asuna, either government or private sector hospital inside Salonia. But not the same doctor that will deal with. Again, I'll tell you something. I don't know, Musa, you don't go Connaught lately?
Yes.
Yeah?
Yes.
You don't go Connaught lately?
Yes.
All of the best doctors in this country, yeah? Now Connaught in the practice. They can go even them and go Mamikoka and other places.
When that Mamikoka, they make them not can get time for them patients.
No, because they put in due now the central government facility. Again, but people not really fully utilize them. But what they say now, we they convert all of that money they all they spend for go overseas for bring and come in.
Okay.
So we'll build our own hospital. And by the way, I'll tell you something. 3 years ago, we started here. Sierra Leone, they produce 50 doctors a year. Then they enroll 50 doctors a year. We are challenging Professor Wuri. We raised that number of enrollees to 200, from 50 to 200. Last year, they enrolled 300. This year, they enrolled 700.
Okay.
So again, what they do now, as then doctor, they train. And they try for build modern facility then for them so that when they graduate and get side for practice. We're not going to get anybody for go overseas again.
Continue for the with Minister of Health, Dr. Austin Dembe. Inside the program now, they will listen to Wakabot.
Another morning again. I say Monday, man. I say Monday. I say Pambul. Go get that kind of liberty. I say God. I say make God able to take it.